Like, you can imagine a patient coming in for a really big, maybe life-changing procedure, and then their anesthesiologist is chasing faxes for 2 hours beforehand. That's not what anyone wants. I'm Andrew Fisher. I'm a clinically active anesthesiologist practicing in Charleston, South Carolina. I function as one of the medical directors for the perioperative care coordination product at Qventus.
I'm Gabrielle Fisher. I am also a practicing anesthesiologist in Charleston, South Carolina. I'm the other co-medical director for the perioperative care coordination solution.
As you may have guessed, we are married, yes. The pre-admission testing process has a lot of areas of improvement and is kind of emblematic of how healthcare has made its way to where we are today. There's a lot of data points that need to come into a patient's experience when they're getting ready for surgery, and usually the preoperative preparation clinics need to do that pretty quickly and get a lot of information in one spot, analyze that information, and then also act upon that. You could see that takes time, that takes effort, and the way we do it now is human capital. Human are spending a lot of time, nurses, mid-levels, physicians are spending a lot of time getting that information together, assimilating it together, and making good decisions on it, on how to get patients through procedures as safely as possible. So, as you can imagine, a lot of areas to make that a little easier.
So when a patient is preparing for surgery, in very general terms, at the very least, they get scheduled for the surgery, and if it's an option at a certain healthcare center, they'll be able to see someone in person for a preoperative visit. It's not always the case though, so optimization isn't always doable beforehand. So when a pre-admission testing nurse is preparing a patient or preparing to interact with a patient, there's a lot that goes on behind the scenes before the phone call or in-person visit even happens. So they're looking through the electronic medical record to see what specific questions need to be asked. That can take in and of itself up to 30 minutes, an hour, depending on how complex medically the patient is. And then once the interaction starts, there's a lot of back and forth between the provider and the patient, question asking on both sides, and getting all of the information that is necessary to prepare them for surgery. So the perioperative care solution, which is built on the AI operational assistance, takes a lot of the pain points that we talked about a little bit already and automates them.
The way I think about the perioperative care coordination solution is it makes my job as an anesthesiologist more simple. I can focus on one data point, which is my patient, getting them ready for their procedure, meeting them on the day of, consuming their chart, knowing as much as I can about them, and getting all that information, again, assimilated and making good decisions on how to get them through their procedures.
So from our current customers who are already using the perioperative care coordination solution, the feedback has been overwhelmingly positive. They are thrilled with the menial tasks they no longer have to do, from making sure patients answer the phone call on the first try. It had been, before we started, at some of our customers, 50% of the time patients weren't answering the phone and they were needing multiple calls and leaving voicemails. And that's not what these nurses did all this schooling for, have all this experience and all of this knowledge. That's not what they want to be spending their time doing, understandably. So even something as simple as getting that from 50% of the time people don't answer down to less than 10%, that's a huge win.
And I think they see that it's augmenting them rather than replacing them. It's allowing them to do their jobs better, not fully taking the place of it, because they still get to talk to their patients and optimize them and have the human touch that allows them to do that. And just removing all these administrative below license work allows them to focus on that kind of stuff. So the advent of these and the deployment of these operational assistants has been really exciting and has allowed me to kind of get excited for two different groups. There's healthcare practitioners and then there's patients. For patients, I think we're actually meeting their expectations of what care is. Everyone goes to their procedures thinking their physicians, their nurses all know their history, and sometimes that's true, sometimes it's not. So with all of this help and all of this additional work that can be done without the human touch, we can make most patients' charts look exactly like their medical history when they get their procedure done and give them the best chance to do perfectly well for their procedure. And then for practitioners, we're allowing them to do the job they thought they were gonna have. Like no one in anesthesia when they're in residency is like, I can't wait to send faxes at 9 a.m. to get an echo from a cardiologist. We wanna take care of patients, and nurses and then in the pre-op clinics wanna get patients ready, make sure they know about the procedure and answer their questions. So these two different groups are gonna have really exciting outcomes and benefits from this, and that's just the thing that keeps us working hard and making sure that the change that we bring is effective.